Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and the topic is distal anatomical term of direction. Okay, so here we will discuss what is distal anatomical term of direction and how it is utilized in medical coding and other sentences and what kind of information basically it provides us. Right, so these all things we are going to discuss in this session. But before we proceed further, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being I'm just mainly focusing on how to use distal in how to understand distal. But prior to that, we have already covered so many other topics like anterior, posterior, superior, inferior, right, proximal. So if you know about these things, then you can relate the things properly. Okay, that's why I'm suggesting you to follow the sessions sequentially. And for that, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content, and in case if you want to ask any questions on it, you can directly reach out to me through comment section, where I can help you personally. Okay, alright, so let's get started with the definition itself. So definition is very simple and straightforward, that distal means farther from the point of origin, farther from the point of attachment, and farther from the trunk of the body. Okay, so if someone asks you in the interview what is distal exactly, so you can simply say distal means any structure or body part that is farther away from the limb, farther away from where a limb connects to the body is called distal. Okay, so in simple terms, distal is farther from the origin, farther from the trunk, and farther from the point of attachment. If you remember this point of attachment, you can easily answer the things. Okay, now to relate it properly, what we will do, we will compare it with the tree, because in proximal also we discussed this, right? So it will give you the idea. Now imagine the trunk of the tree is equal to the trunk of the human body, that is chest or abdomen. Now in this case, branches can be considered as a limbs, that includes arms, legs, right? So now the part of the branch closest to the trunk is called proximal, and the part of the branch farther from the trunk is distal. Clear? So these two terms are opposite of each other. Proximal means closest and distal means farther. Okay, so here if we take one example, so the fingers are distal to the wrist because the fingers are farther from the trunk of the body than the wrist is. Okay, now these things will change according to the second structure, because we mostly use two structure, right? So if the second structure is distal, so we will consider the first one as proximal. That I'll show you with example, so that it will give you the idea how it works. But one thing is confirmed, that the direct opposite of distal is proximal, where distal is farther from the trunk or origin, and proximal means closer to the trunk of origin. Okay, and these two terms always work as a pair. You cannot understand one without knowing the other. That is true. If we want to take example, so you can see the fingers are distal to the wrist, the shoulders is proximal to the elbow. So most important rule about distal and proximal is, distal and proximal are primarily used to describe the structure of the limb, like arms and legs, and tubular structure like blood vessels, nerves, and digestive tract. Okay, fine. So now this is also an important point, like unlike the other directional term that apply to the entire body, distal and proximal are most commonly and most correctly used when describing upper limbs like shoulder, arm, elbow, forearm, wrist, and hand fingers. Similarly for lower limbs including hip, thigh, knee, lower leg, ankle, foot, and toes. Similarly for blood vessel, arteries and veins, nerves, nerve trunk and branches, digestive tract, from mouth to anus, urinary tract, kidneys to urethra, and bones ends of the bone. Okay, now if you compare these sentences with the meaning, so the fingers are distal to the wrist, the wrist is distal to the elbow. Why fingers are distal to the wrist? Because fingers are farthest from the trunk, that is chest and abdomen, but wrist is closest to the trunk, right? But in this example, wrist is distal to the elbow because here we have changed the second structure or body part, that is elbow. So in this situation, elbow is closest to the trunk, not the wrist. That's why wrist is at distal. Third example, elbow is distal. So now in this case, elbow become distal because it is closest, it is not closest to the trunk. Here shoulder is closest to the trunk. Okay. Likewise, the toes are distal to the ankle is distal to the knee. So this is how you can use it in order to compare the body parts in a simple sentence. Now let's see what is how it is utilized in medical terminology. Although there are so many terms used that use this distal or proximal kind of thing, but here I'll just give you one idea so that we can cover the topic, and later if needed we will discuss in detail. Okay, so the medical term like distal humerus fracture is the fracture at the lower end of the arm bone near to the elbow. Okay, second is distal radius fracture, fracture at the lower end of the radius near to the wrist, that is most common fracture in the adults. Then we have distal femur fracture, fracture at the lower end of the thigh bone near the knee. So these are the all terminology that are using the term, directional term distal, just to tell us the information about the distance or the direction. Not distance, actually direction. Okay, all right. Now so far we have learned about so many other topics, right? But it's bit hard to understand and remember all these things together, right? So to make the things easier, I have provided you one memory tip here. So for distal, you know that distal start with the letter D. So here D is denoting the distance. Okay, so whatever is far from the trunk is at distance, so we can say it is distal. Okay, so in simple word, distal the end of limb, like fingertips and toes. Proximal the start of the limb, that is shoulder and hip. Another easy way to remember, distal is distant, far away from the trunk. And if you want to compare it with the river, so the source of river is proximal, origin close to the trunk. The mouth of the river where it meets the sea is distal, far end, fingertips and toes. And water flows from the proximal to distal. So the simple way, just to remind it, like proximal where the limb begins and the distal where the limb ends. And if you want to compare it with like a road, so the road that starts in the city is proximal and that ends in the countryside is a distal. Clear? So yeah, in today's session we talked about distal. We understand like how it is different from the proximal, what is the difference between distal and proximal, how it is utilized with examples and other basic stuff. Okay, now as usual I'm going to assign you one question, and today's question is, what is proximal anatomical term of direction? Although we discussed this in this session also, but it's in just a recap manner. But in last session we have discussed it in a very detailed way, and I'm sure you already know the answer of this question. So just I request you to please do share your knowledge in the comment section so that others can take a reference from it. Okay, and also it will give me the indication that you guys are learning from these sessions, and accordingly, like if I got lots of response from your end, so accordingly I will release the other session that I have prepared for the medical coding playlist. Okay, so yeah, please do share your knowledge, and in case if there is any question related to this session, maybe related to the any other playlist or session, you can simply reach out to me through comment section. I would be more than happy to answer all your questions there, and if in case if there is any kind of suggestion, I'll for sure look into that suggestion as well, and we'll try to see how we can implement it. Okay, so yeah, that's all for today. and in the next session we will discuss few more things. So thank you for watching Tech Sharmit.